Hello guys, welcome to SKK Classes NZ again. So today in our video we are going to discuss about diarrhea. Okay, I think you people are very much familiar about this word or this medical term diarrhea. Okay, so today we will discuss about the signs, symptoms as well as the treatment and as well as the you can say the remedies that what we should do at our own level to prevent this and to prevent the main complications that can occur due to diarrhea. So let's discuss about diarrhea. So now the question arises, what is diarrhea? So diarrhea refers to if you are having 3 or more loose or liquid stools in one day or more frequently than normal, then it means you are having a diarrhea or gastroenteritis. Okay. And if you have a diarrhea, you will experience an increase in the volume, okay, wateriness or frequency of your bowel movements, okay. And diarrhea episodes that are often caused by a stomach bug, that is gastroenteritis. So gastroenteritis always refers to stomach and itis word refers to inflammation, means and this inflammation of the stomach can be due to any reason, okay. And due to that you are always having like gastric problems, and this problem gastroenteritis may be due to some you have eaten some contaminated food, okay. So all these things leads to diarrhea, and most diarrhea are in mild in nature, but they can be severe, okay. And sometimes you need hospitalization. And, if we are talking about the signs symptoms of diarrhea, okay, so diarrhea, if you have you're passing like 3 or 4 more stools in one day, so you always feel sometimes nausea, you always feel sometimes vomiting, okay. And you are also have sometimes fever, okay, and headache and bloating, flatulence or means excessiveness of gas in your stomach. Then you always feel abdominal cramps or pain in your stomach, and with some clocky pattern, okay. Stomach pains are most common. Then loss of appetite, means you always say that I don't like to eat anything, and if you eat something, that will create a problem in your stomach, and after eating you always feel pain in your stomach, and you always feel weak. And dehydration. Why dehydration? Because you are passing stools, okay, more and more, and your fluid level that will gonna decrease, so it will leads to dehydration. That's the main reason. If the patient is having a severe diarrhea, so he or she has to be admitted in the hospital for proper care and treatment. Now see in this picture, here the main causes of diarrhea, they are given. So first main cause is parasitic infection, means if you are having some infection due to some parasites, that can lead to diarrhea. Then viral infection, bacterial infection, or food intolerance, means food intolerance means if you are having you are eating some food and you are not able to digest it, then you can easily get diarrhea. Then your food allergy, if you are having some allergy due to any food. Then medication, some medications are very strong, so they can cause diarrhea. Then intestinal disease, gallbladder or stomach surgery, then some type of cancer, they can cause diarrhea. And even though in diseases like diabetes, in that case you can also get diarrhea. And unsuitable lifestyle and diet, means sometimes your diet can be different, okay. So this thing also depends upon your diet, means if you are eating some lot of spicy food, they can also trigger the diarrhea. So let's discuss about some food that can trigger diarrhea. So the food which trigger diarrhea, like fats, alcohol, fiber, caffeine, chili, dairy products. So these are the food, they can trigger diarrhea if you have some little problem in your stomach, okay. And if you and in that situation, if you are eating all these food, they will trigger your diarrhea. And so you have to very much careful about this thing. And if you're talking about the lab diagnosis, so doctors always recommend blood test, stool test, as well as in severe cases, if you are having a severe diarrhea or you are in a hospital or in the ICU, so the doctors always gives the order to perform the endoscopy, colonoscopy, biopsy if they are suspecting that the patient can have cancer. So in that situation, doctors do the treatment according to that situation. Okay, but most probably if the diarrhea is at first stage or in mild stage, doctors always try their best to treat the patient with some medications. Okay, and in severe cases, they will start the IV fluid or intravenous fluid administration, so that the fluid that gonna loss due to watery stools, that will get restored. Okay, just to restore the fluid volume. So doctors always start the IV administration. But if they have suspected that this patient is you can say feeling that doctors feel that this patient having a dehydration. Okay, so this is all about the definition of diarrhea, signs, symptoms of diarrhea, and what are the main factors that can trigger diarrhea. And in our next video, we will discuss about the main types of diarrhea, as well as what type of treatment that should be given if the patient is having a diarrhea, or what type of treatment or home remedies that we can use at our own level to prevent the diarrhea, so that it should not gonna to be severe. Okay, so till then, thank you for watching SKK Classes NZ, and don't forget to subscribe my channel. Thank you.